As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'm gonna roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, let's camera action.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
Good morning, everyone. Maritza Bond, Director of Health for the City of New Haven, was going to be, she's been called away. And actually, I'm kind of pleased that Stacey Hutcherson, the Director of Public Health Nursing for the City of New Haven, with me instead. Stacey was on a show with us earlier a few weeks ago, and although Maritza is well known, I'm sure we'll get her back. Just reminded me that in terms of a war, and Stacey, I got to kind of take a privilege since I have the mic, that people want to talk about a pandemic and an epidemic and crisis. We're in a war as far as I'm concerned, and I use that term really. I don't think, just my personal opinions, my personal, call it personal bias, but we're in a war and one person doesn't stop. You know, one person might fall down, get sick, die, and somebody else will step up to the plate. And that you can have a team to kind of fight a war successfully. So the City of New Haven Public Health team has some great folks on staff, and Stacey Hutcherson is here with us, Director of Public Health, to illustrate and epitomize that it's a team approach. We have people on the battlefield, and the community can deputize ourselves, Stace, and join the public health crusade. Today is, in fact, in my mind, a discussion about public health, but it's a public health crusade. So what am I trying to say? We're going to talk about COVID and even a term called situational awareness. You probably watched CNN and have seen where Wolf Blitzer talks about what do they call it? The security room, or what phrase is that?
What is that called? The situation room.
The situation room. We are in a situation room. This is a crisis. So we're going to talk about the COVID situation at the moment in general, but also specifically these words, Centers for Disease Control, and these words, Food and Drug Administration. These governmental entities are key for us. Centers for Disease Control, Food and Drug Administration. Don't get bored by hearing these terms. Terms are going to be with us forever and a day, quite frankly, and we need to know how they operate. But we're going to particularly talk about the Centers for Disease Control and FDA, Food and Drug Administration, pertaining to the pediatric vaccines, the ages 5 through 11. Guardians, your list, stay with us for 5 minutes, because there's going to be knowledge that you're going to get, that you're going to have to share with, that I'm going to beseech you, I'm going to pray for you, I'm going to get down on my knees, share with people about this information that Stacey's going to share with us. Number of eligible people, New Haven children that are going to be eligible for this vaccine. Important, between 5 to 11. We need to know this. This is not there's somebody in your door, on your step, on your right or left, at job, at your church, that's going to need this information. And pediatric vaccines, we're going to hear continual myths about the effectiveness and the safeguard of it, but we're going to hear about the facts that it is safe, it is effective. So Stacey, you can see I'm riled up, man. I'm tired of talking about this issue, guys. Let's get vaccinated. But also the New Haven Health Department's partnership with Griffin Hospital. The health department does not operate in isolation. There are partnerships, great people that are helping us out institutionally and individually. And also the schedule for pediatric clinics. How are we going to roll this out? All right now, people are going to get it soon and effective and safe, convenient. And something called It's My Turn. I've spent 30 years or so in terms of marketing and PR and advertising and messaging. And the battle is for the minds. Advertising campaigns could be negative, advertising campaigns can be positive, but It's My Turn is something I'm really excited about. Stacey's going to tell us about that. And lastly, we might conclude about myths and facts, just to kind of knock people over the head with the truth. Because the earth is no longer flat, although some people might still believe it. Stacey, let's jump in. Talk about this. We're in the situation room, COVID situational. What's cooking?
So I like your analysis, or your analogy rather, of it being a war, because we're in a military footing, and being in the situation room, we have to give situational awareness. And to update you all on what is actually going on with our fight against COVID, we, as of last Friday, November 12th, 70 plus new cases of COVID. That's a 14-day case rate. That's like 7 cases per 100,000 persons in the population. Positivity rate is 1.10%. The county level community transmission is substantial. 75% of the age eligible New Haven residents have received their first dose of COVID-19 vaccination, and roughly 69% are fully vaccinated. So we received an estimated 200 doses for the age group 5 to 11 in our clinic at 54 Meadow Street. So these are our current situation. This is our current situation and what we're doing to try to continue to fight the fight. Myself being ex-military, I like that analogy. Thank you very much.
Well, and again, we just celebrated Veterans Day. What some people might recall this really Armistice Day, and actually Veterans Day and Armistice Day was to be the World War I was supposed to be the war to end all wars, and so we haven't really fulfilled that manifestation. And even if you've never been in the service, and I've never really served, my uncles did. A servant, being a citizen is a servant. So but at any rate, but Stace, take us a little bit to the updates in terms of the CDC and the FDA in terms of ages 5 to 11, because this is obviously a sensitive thing. I mean, 5, 6, 7-year-olds.
Sure.
So share with us what's cooking there.
So to help us continue to combat this fight, the CDC and the FDA authorized Pfizer usage on November 3rd for the demographic age 5 to 11-year-olds. The vaccine has been, researched for quite some time, and the FDA and the CDC, which you mentioned earlier, are our tools and our instruments we use to find. They do our research and they do the development, and they continue to vet what comes to market for us. So we go by their direction. So if we were to use the analogy again, we're the foot soldiers on the ground and they're the generals helping us charge this fight. Now, having said that, I do want you to understand that just as the adult vaccination is a 2-series vaccination, the children's vaccination is also a 2-dose vaccination. Once your child has received both the first and second doses, 2 weeks after that, they have then obtained full immunity. I just want to put that caveat out there. In addition, your child's dosage is 1/3 less the adult dose. So the adult dose is 30 microns. The child's dose is 10 microns.
And so are you implying, Stace, that, and again, this is not a trick question, that a booster shot might be needed for folks 5 to 11 as well as it had been for some adults?
So I don't know any secret information to that regard, but the way we're moving with the adult dose, it just stands to reason for me to rationalize that. In fact, that would be something that I think would come down the pipe.
I raise that because all of our health providers, health messengers, are in such a super sensitive position. Not that you have to parse every word, but you got to parse every word, because someone will say, "Oh, I heard Stace say this." They don't listen to the end of the comment, or they hear some news. So people are just speculating what's down the road. So as you have so articulately put, it's not beyond the realm of imagination to consider the fact that same way we have flu shots every year.
Correct. It is. I'm sorry.
Go ahead.
It is a very difficult position to be in because, again, there's so much disinformation out there, and there's so many, I'll use air quotes, experts that, we are becoming COVID fatigued, right? Just like you alluded to earlier in the conversation, this war is taxing. And I think we're having a bit of battle fatigue. With that said, people still not wearing their masks, people still not having accurate information about why they should become vaccinated. So we've all have become inundated with information. And I think we're just wanting to get back to some sense of what normal life is. And I think that becoming vaccinated will get us there faster.
And so quickly to get back faster, just tick it off again. Wear the mask, wash your hands, just tick off some of the
Sure, absolutely. Well, we want to continue good hand hygiene, right? Especially among our children, because 5 to 11, I mean, how many of us have children, and how many of us know that they harbor bacteria and viruses, right? So good hand hygiene amongst this population, as well as among, the general population, is imperative. Right now, my sons both have a sinus infection, and I'm like, Dad, they say to me, Dad, I washed my hands already. Okay, well, you just blew your nose, go wash them again. So use soap and water, sons, I have to tell them. You just can't run your hands through the water and not, lather with soap. So it's a thing at the house. But nevertheless, practicing good etiquette when you sneeze or cough, you want to go on your elbow. We're just trying to decrease the spread of viruses and bacteria as best that we can. And when you're sick, stay home.
Absolutely. Let's jump Stace to actually about masks. What's your feeling about the wearing of masks, and when and where and how?
Well, I think that, wearing mask when you're in a congregate, when you're in a densely populated area, if you're in an apartment building, say you live in a skyrise, you're on an elevator, at the office, when you're outside, of course, you don't need to necessarily wear a mask. If you're unable to socially distance, of course, you want to wear a mask. Even if you are vaccinated, it's a courtesy, in my belief, that you want to protect your neighbor. You want to protect your friends. You want to protect your family members. Just one little caveat I'll share with you.
Please.
This year, the kids and I aren't able to travel to see grandma and grandpa who live in Arizona because the timing of the vaccine coming out, they're not able to complete their series and have 14 days of being fully vaccinated. So, unfortunately, they won't be able to see grandma and grandpa. They weren't able to see grandma and grandpa this summer, which they usually spend their summer vacations out with grandma and grandpa. But, I have an aunt who's coming out to visit grandma and grandpa in Arizona who has fought a very courageous fight against leukemia and is doing quite well. But I just don't want anyone to feel comfortable. And I don't want my children to bring something that could potentially harm my parents or my aunt. Mm-hmm. So we're holding off, and hopefully, we'll be able to get there for Christmas.
There you go. And so, again, go ahead, please.
So with that said, I don't quite like the idea of us going there and them not being vaccinated, and we're having a meal and they're taking their mask down. So I think that masks have contributed to there being less of an impact with influenza last year, because we were all masked up. And I just think it's a good practice. And I'm hoping that once we gain herd immunity, it's a practice that may still be in our society to some degree. However, I'm hoping that we have less of it.
Indeed. And as we approach Thanksgiving, et cetera, needless to say, Christmas, as you say, really things we need to be cognizant of. Again, part of the focus of the show today is on the 5 to 11 group, and Stace, just kind of remind people, if you would, about the number of eligible New Haven public school students.
Sure. Currently, we have about 12,000 persons in New Haven of that age group that are eligible for the vaccination. We are really excited about being able to provide protection at 54 Meadow Street for this demographic, as well as everyone else who needs their booster shot. In addition, we're still giving out flu, by the way. I'll just throw that out there. So yeah, we have about 12,000 residents, and in total, roughly 122,000 New Haven residents are now eligible for the COVID vaccine.
So now again, the number remaining of adults or total residents that are still eligible are how many again?
122,000.
Still needed. They're still in need.
Correct.
This is
Correct.
not including ones that have been vaccinated, that have had vaccinations already.
That's correct.
So what is that number again?
122,000 New Haven residents.
As I'm walking around town, there's a good chance that somebody I'm going to see. I mean, because many of us, we joke and kid. Many of us, I shouldn't say many of us. I've gone out to events where people I know that have gotten their shot in my age group. But again, that's not the total part of New Haven. 120,000.
Correct. I just want to kind of go back to children real quick, and I just want to share this statistic. Since the beginning of the pandemic, about 1.9 million children from ages 5 to 11 were infected. So that's about 10% of the total U.S. population. So of that number, about 8,300 were hospitalized, and about 94 succumbed to it, passed away. And that's according to most recent federal data. The death toll in the past year puts COVID, are you ready for this? Puts COVID in the top 10 causes of death in that age demographic.
Say that again.
So, COVID is in the top 10 causes of death for 5 to 11-year-old children.
Indeed. And again, people have accused me of being too somber and Death Watch and Darth Vader kind of perspective, but come on, guys, this is serious. And so Stace, shift to the fact of the safety, the effectiveness of the vaccine.
Correct. Well, the vaccine in itself is very safe. CDC, FDA have vetted this vaccine, and the coronavirus itself, in terms of a vaccination for it, has been researched for years. So I just want people to understand that piece right off the bat. The benefits outweigh any risks. I know people initially came out saying myocarditis was an issue, but I do want people to understand that those kinds of side effects or risks associated with this virus are very low. And I know that when they happen, God forbid, whenever they happen, it becomes a media hype, and for those persons, especially who are vaccine resistant, meaning they don't think it's a thing that they should do or we should be promoting. So those serious adverse effects are rare. I just want to definitely emphasize that. But Pfizer's clinical trials, over 2,000 children, and when they conducted the clinical trials, they found out that Pfizer was 91% effective against symptomatic infection. So is it safe? Yes. Now, you hear these rumors about it's going to affect my DNA. It does nothing with your DNA. It doesn't even interact with your DNA. Furthermore, you hear these comments about infertility. Not even a thing, Tom. So when you hear these persons on the internet, YouTube, wherever you may run into these persons, you have to fact check that. You got to fact check where they're coming from and who this information is coming from. Who are these people? Where are they getting their information from? Because again, we get our information from scientists who are working with this, and not just this alone. These scientists are working with those diseases that impact our community, the United States, and globally. So these are experts in their field. They're not somebody who's come up with the idea that you're going to get a chip implanted into you if you take the COVID vaccination. So Tom, I don't really know where that information comes from or why that information would even be disseminated. It's rather concerning to me.
You're listening to Stacey Hutcherson. Stacey's Director of Public Health Nursing is that your correct title?
Correct. Correct.
And you're relatively new as a face to New Haven, but I live in the Stratford area, so I was glad we chatted a few weeks ago, and I'm glad to have you back because with the COVID and so many things being virtual, people would have seen your face in person much more than they have thus far if we didn't have the circumstance kind of occurring. So we look forward to seeing you in person at the Delta events and the WAC events and the various health fairs and et cetera.
Absolutely.
So that'll be that'll be fun. Talk to me, Stacey, a little bit about your background and your passion for this work,
Sure.
if you would.
Sure. Well, my background, I was ex-military. I was a Navy corpsman, so that's the equivalent of a paramedic serving with the Marine Corps and Navy. I served for 12 years. I've been through some pretty harrowing experiences, and having graduated from Sacred Heart University, I had a professor that kind of impressed upon me how important community health really and truly is. So in my nursing experience, I kind of wanted to take my experience I had in the military and sort of validate it. So I worked in surgical ICU, I worked in ER, I worked in the operating room. I wanted to be able to take care of a patient, much like I did in the military, from the point of entering into a healthcare system, the ER, a long-term situation, and intraoperatively. So given my military experience, I mean, I had the opportunity to be exposed to that level of care, those levels of care. So I legitimized my nurse training by continuing along that trajectory. But always in the back of my head, I would remember my professor, and I'll say her name, Professor Strong. I had the opportunity to have some community health experiences, and I saw what healthcare inequities look like, and I saw how it impacted diverse communities. And so I wanted to kind of be a part of correcting that as best as I could, or influencing it as best that I could. So that's kind of the ration behind where we are.
Well, okay, nice. I accept that. That. And I guess as you're speaking, I'm thinking of your biography and the 15 chapters that would be in your book, and that's like the first paragraph of the first page there to say something. I'm going to ask a follow up.
Sure.
When did you decide? And I asked this question not necessarily jokingly, but very seriously. Decide that healthcare. You mentioned the service and joining in that particular field expertise, like health and caring for people. Were you like 10 or 11 or 12? Do you remember when that light bulb went off? And guess what influenced you to kind of be in this, I'll call it a giving and servant relationship with people?
Sure. That's a really great question. And it's not one, believe it or not, Tom, that I ever even think of. It's more or less how life evolves. And I think that where you are is where you're supposed to be. And my life has evolved into bringing me into a service profession. And I got to tell you, I think choosing this profession is probably one of the best decisions I made in my life, other than having my two sons. It's been the most fulfilling career that I could have probably chosen for myself. So it was more or less the exposure in the military. I knew it was something I wanted to do when I joined the military, and kind of just so much to know and so much to learn. That was probably the draw, and being able to, take care of people in their hours and moments of dire need sometime, or just need.
Indeed. I'm going to have a follow-up question there. We're going to talk about, if you're listening between now and when the show ends, about the partnership the New Haven Health Department has with Griffin Hospital. We're going to talk about the schedule of the pediatric clinics, kind of the rollout stays on the logistics and how easy that will be. Information about It's My Turn, and also myths and facts you have alluded to, but I want to kind of conclude on that. But the question I have for you is that you've seen blood and guts early on.
I have.
And how has that informed this is a philosophical question, about life and about death and about human behavior? And I say that because it's a mystery. My brain cannot compute the fact that people are resisting getting vaccine. I've read, I've heard, I've listened, but my brain just freezes. My brain freezes when I hear they don't want to get it. So I'm just curious, a person like yourself that has seen the varieties of the human experience, pathos and the drama and the angst and the death. Let's be frank, the death What does that kind of say? What kind of personal philosophy have you kind of concocted over these years?
Well, well, given my life experiences, and having had the experience of seeing some tragedy, I served in active combat, and not just that alone, but taking care of people in the emergency room who succumb to their wound or whatever the case may be.
Mm-hmm.
My life philosophy is I live life first, because it's a gift and I'm grateful to have it. And more so than anything, I think what changed everything was becoming a father.
Hmm.
Sorry.
No, I mean, yeah, the emotions rule our behavior. Our
Mhm.
conscious emotions, our unconscious emotions. Emotions,
Yeah.
I think we're grappling as a civilization with dealing with, saving the whales, saving ourselves. You can see there's so
Right.
much going on that we're just not in touch with about what does it mean for all of us to survive in the
Right.
future.
Right. So for me, it was becoming a father and looking at that life, my first son, and of course, thank God I was blessed to have another one. Looking at those lives and knowing that I'm responsible for them.
Right.
So, that's the motivation and the drive. Again, motivation and drive to become vaccinated for my children.
Indeed, indeed. And I hope that all the parents and grandparents and adults will hear this, because even if you're against getting vaccinated, please, if you're in touch with a 5 or 11-year-old, think about their life. But I digress. Stacey, let's go to the partnerships
Sure.
in the New
So,
Haven Health Department
so
Hospital.
sure. Through the Department of Health and Griffin, the State Department of Health, New Haven, we partner with them to ensure that we have set up the opportunity in the New Haven public schools for children and parents to have their children vaccinated. So the idea is to bring it where they are, right? So where do we spend a great deal of our time as kids? In school. So the partnership with Griffin Hospital and the Department of Health, we've been able to set up some clinics in schools. We've garnered a lot of energy around this particular program. There's been a lot of requests in the New Haven public school area, and we're doing this in partnership with the Board of Education as well. So again, it's the idea of being able to bring it to where they are. So
Yeah.
children would have the opportunity with their parents or their guardian, because you need your parent or your guardian to sign consent, and the parent or guardian needs to bring proper identification so that we can have authorization from the parent or guardian to vaccinate that child. So this is a tremendous effort. There's probably going to be some social media stuff about it and some things out in the press, but this is what we're doing in New Haven. And in addition, our clinic at 54 Meadow Street, we are ready and we have already vaccinated children in this demographic. Our hours, you can find our hours on our website, but our hours are Tuesdays, Thursdays from 9 a.m. to 5:30 p.m. and on Fridays, 9 currently to 2:30 p.m. But I'm trying to extend those hours on Fridays, and I'll tell you why. I'm trying to extend those hours on Fridays, and we're trying to have some clinics on Saturdays because, parents work,
Sure.
kids go to school, there's soccer practice, there's all kinds of things going on. And the reason why I said Fridays, because one of the things I want you to understand, audience, is that your child may have a sore arm, your child may have a headache, and they may have a fever. That does not mean your child has COVID. That means that your body is doing what it's supposed to do. That's your body's immune response that's going to combat COVID if your child ever becomes in contact with the real thing. So the reason why I want these Friday clinics is because that way the kid won't miss school on Tuesday if they get it on Monday because they're feeling a little under the weather. Again, I want to reemphasize, that's not COVID. That's your body doing what it's supposed to do. It's an immune response.
Indeed. Indeed.
So then if you get your child vaccinated on Friday, you have the weekend to kind of recoup, keep them in the home, and they go back to school on Monday.
And Stacey, the number of eligible New Haven children between 5 and 11, what's that number again?
12,000.
And so when should we expect as a consumer to hear about the official rollout and the plans and the logistics and the hours in the next few weeks, next few months, or?
Sure, that's going on right now. So the big campaign is It's My Turn. So that's featuring New Haven school children. That campaign should start this week. And
Okay.
so this is the last one age demographic 5 to 11 to be eligible. So there's going to be a huge campaign around It's My Turn. And let's see. Okay, what else can I tell you about that? That's pretty much going to be on television ads, billboards, and radio, social media. So you'll be hearing a lot about that this week. That's our big media campaign to get that age group vaccinated.
Good. And what's in terms of your crystal ball, because I know you have one, I can you're a wise man, and if you don't have one, I'll kind of share mine with you, but mine might be broke, but you got it right. But at any rate, for all the young people between 5 and 11 who become vaccinated, are we hoping by March, April, May, June? What's the, God willing, what might be the desire and the perspectives for implementation?
Sure. It's a very tough question to answer, because to become vaccinated or get your child vaccinated is a personal choice. We're just trying to give you the information to help you make an informed decision towards vaccinating your child. So if I were to look at it from a parent perspective, I would say there's opportunity during Christmas break to get your child vaccinated. Although I would encourage you to do that well before then, if you want, to spend time with grandparents, for example, or to be at the dinner table with family from out of town. So, but again, thinking it from a parental perspective, I'm looking at what points are they able to reach and access vaccines. So again, 54 Meadow Street, the efforts we're doing with Griffin Hospital and the Department of Health, bringing the vaccine in these mobile vans to New Haven Public Schools. So we're trying to do our best efforts to put it out in the community so that we can help parents make better decisions and have access, make it as easy and as accessible to New Haven residents as we can.
Indeed. Stacey, we have about 15 or so minutes. Let's do a little bit of segue about, we have other responsibilities beyond this. And I think it's helpful to kind of to remind folks that the fact of nurses have a nurse in the school, how critical that is. So talk a little bit about that, your scope of influence and the mighty warriors that are kind of connected with you.
Sure. Much like Colin Powell, and God rest his soul, he always said that I'm only as good as my soldiers, since we're still using the war analogy. And fortunately, we have been able to provide nurses in every one of our New Haven public schools. And every day, I got to tell you, they're fighting the fight. They're trying to keep, I want parents to understand, the role of a school nurse is to try to keep everyone safe. And so when you get that phone call from a school nurse saying, please come pick up your child, they have a fever, they're not only just looking out for your child, they're looking out for the student body. And they may not always get it right, and they may get it right. But the idea is that we're here to protect your child the best way that we possibly can. And in our New Haven health system, in our New Haven public school system, we have a lot of children that deal with healthcare inequity. We have asthmatics, we have diabetics, we have students who have seizures, newly diagnosed diabetic students that we have to make sure that we're checking them before lunch, after lunch, doing their calorie count, so we can make sure their insulin is set at the right level. So our nurses, they put in a lot of work. And now you throw COVID on top of it, it's been double, if not quadruple, the work for them. And my hat goes off to them every day that they are serving a very diverse population, and they are very empathetic to our New Haven demographic. And so I'm proud to be a part of that.
You've referenced, Stace, the word either specifically or by nuance, equity, et cetera. And I've been blessed to do a few shows on, actually more than a few on this topic. And sometimes it gets, if I can be fully transparent, discouraging to kind of talk about what needs to happen and not see it happen. But so I'm intrigued when you use that term about equity and social determinants of health, although you didn't specifically. What does that mean to you, and how do you see your charge in enabling us not to have this discussion much longer? I'm tired, Stace. I'm tired talking about this.
Well, I think that in the city of New Haven, I think the leadership in New Haven is doing their very best to try and make it less inequitable, if that's the best way I can put that. We have school-based health clinics, which is, I think, is a great model for kids to gain access for preventive care, primary care, even dental in some cases. So that's a model I think is tremendous. I also think that my charge as a director of public health, that's community health. My charge is to be screaming as loudly as I can from the mountaintop.
Yes.
To ensure that these children have access to childhood vaccinations. To ensure that these kids are able to get a physical, vision screening and hearing screening early on, because some of these determine how well a child does in school. Who knew that little Joey couldn't see the chalkboard or see the whatever the board is they use nowadays? It's been a long time since I've had that experience. But those kinds of things, healthcare inequities can show other inequities or cause inequities in other ways, like with education. Who knew that little Joey couldn't hear what the teacher was saying? And the teacher probably thought little Joey's just a discipline problem, right? But because we have school nurses there, we have the school-based clinics there, we can kind of mitigate some of those.
Excellent. As a little bit of a stretch, Stacey, not to put you on the spot, but just as you were talking, I'm thinking about, and you referenced the various categories, health and biological categories. What about violence and how that might kind of be affecting young people? Huge.
It's Tom, that's a whole nother show for you and I, by the way. And it's very near and dear to me. And I get just emotional about that as I do my kids.
We'll do this.
So it's definitely something that we need to address. It's a travesty. It's a healthcare emergency. And it's happening in Black and brown communities. And I, as a Black man, as a father, I feel I need to do what I need to do to stop it.
Indeed. Well, the crusade is needed, and we'll certainly do another show. And we've had a few folks that talked to offline about this, and also our public discussion now, because it's so important for people to know that we're not there's angst and pain, but we don't have to kind of share it, don't have to kind of embody it individually, and don't feel that we can't kind of heal one another. But it's going to require kind of this continual collective effort. So I appreciate.
Well, the reason why I get emotional about it, Tom, is because it has affected me in my own personal life. But I'm a part of a broader community. And if I'm sitting by, coasting and watching it happen, then I don't feel like I've done my part to stop it. So yes, Tom, I think that's a whole nother conversation and another show, but I'd be happy to have that conversation with you.
Excellent. You're listening to the Tom Ficklin Show, and Stacey Hutcherson is with us, Director of Public Health Nursing for the City of New Haven Department of Public Health, and relatively new to New Haven, not new to Connecticut. Just so glad to kind of be chatting with them. Stacey, we have about another 12 or so minutes. Let's kind of freelance a little bit of things that might be on your mind. And I'll let you go first if the spirit is moving you in any direction, if something's kind of crossed your consciousness.
Well, I mean, you brought up the gun violence, right? And I used to be an ER nurse. I saw it firsthand. And the group of friends that I spend my time with, they're all fathers, Black, brown, white. And these are the conversations that we have. I am my brother's keeper. And we all feel that way. So we try to think of ways in which we can continue to be our brother's keepers. If it's food drives and Thanksgiving, if it's hats, coats, gloves, if it's providing material for kids in school, if it's coming to talk to kids in school, if it's coaching, if it's mentoring, those are all ways that we can influence this violent trajectory that we see among children, teaching them how to de-escalate confrontation. As simple as a confrontation on the basketball court when you're coaching. We have to provide these kids with the tools necessary to make better choices and better decisions. So that's probably one of my biggest, what's the word I'm looking for? Concerns, as well as being a nurse, because I see it as a healthcare crisis.
For sure, as you say, so it's interconnected. Absolutely, absolutely. Our biological health, our physical health, our mental health, our economic health. It's all kind of connected. There's one continuum there. Just as you were talking there, Stacey, my mind flipped back to the "It's My Turn" campaign, because I believe, but correct me if I'm wrong, that young people will be involved with the.
Absolutely. I forget the number of students from New Haven. I think I said that earlier, but yes, students from New Haven school districts were going to be involved and try to get the campaign out and promoting it. But one other thing you touched on was mental health. And I wanted you to understand that mental health has been recognized since COVID. It has been recognized in how it has impacted young children with not being able to go to school and see their friends and socialize. So these things are very important to recognize as well. So having your child vaccinated and having them be a part of the social circles again safely, we're a whole person, right? So it's physical, it's mental, it's spiritual, and all those touch points have to be in balance, right? So if we can get these kids back to doing what kids do, then kudos to us.
And I was reading something just in that same regard, Stacey, about the measles vaccinations have declined. Now we're like almost a semi-crisis again in terms of younger people not having the measles inoculation.
Sure. So one of our efforts in public health here in New Haven is to ensure that everyone is vaccinated, meaning their childhood vaccinations and so forth. So we, my nurses, have been diligent about partnering with schools administrators and getting kids access to those vaccines that they could not get access to during the high points in the pandemic, where we were pretty much shut down. If you were seeing your doctor, you were seeing your doctor, much like we're talking together today. And I'm sorry, I can't think of a needle long enough to reach you from where I'm at right now, Tom. So a lot of childhood vaccinations were skipped. And this is one of the things that concerned me the most. And I expressed my concerns about it, because what do we need? We need a measles crisis on top of a pandemic? No, I don't think so. So please get your child to their pediatrician, get them to the clinic at 54 Meadow Street, and get them their immunizations in addition to COVID.
And elaborate, as we have another 10 minutes or so, on the flu, because I want people to just see this whole panoply, this menu of dead ends that we want to avoid going through. To talk about flu shots for a second.
Sure. We're still giving out the flu shot. You can get the flu shot simultaneously, believe it or not, with COVID vaccination. The flu is something that we've dealt with for centuries, right? Yes. And it's going to be with us for the rest of our lives. And very much how we're getting the flu vaccination, and we've been able to, by the way, influenza is another, it's in the top 10 of causes of death for this demographic, by the way, 5 to 11. I think COVID is probably roughly around 6 and number 6. And I think influenza is like number 5. Now, how recent that data is, I don't know. Maybe it's changed positions. But yes, it's still important to get your kids vaccinated for influenza, as well as older adults.
Indeed. And teachers.
Absolutely, because they spend a great deal of time around those little germ carriers, right?
I'm going to switch. I'm going to ask you a question. Again, it's philosophical. There's no right or wrong answer. But when you look in the news, just given the passion that you've expressed in your consciousness, not only just from your mental time that you've invested in healing and people living, but just your occupational time for, not to get personal, but at least 35 to 40 years you've been involved.
Easy.
So when you read about fire people in X city, police people in X city not getting vaccinated, what goes through your mind?
It troubles me.
But paraphrase trouble. It troubles anybody. It troubles any citizen.
Sure.
But given your expertise, your experience, your dedication, what goes through your particular mind?
Well, we're here to provide a service, and we're here to protect the community. And I would feel terrible if I was taking care of someone and I got them ill. And just as a side note, Tom, before I got on with you, I saw something come across my phone. I believe it's in Kentucky, where they're deciding not to mandate the vaccination for National Guard members. So I just thought that was interesting, because as a service member,
Indeed.
and there's plenty of service members who become firefighters or become police officers.
Yes.
And you got an array of vaccines.
Indeed.
When you were in the military. So it boggles my mind how you could not continue to protect yourself and the communities that you serve by not vaccinating yourself. So again, it's an individual.
What is your theory? What is your theory, your hypothesis? We all like to think that we're layperson psychologists and psychiatrists. What is your theory? Do they have a death wish? What's your do you have a theory or a hypothesis?
I really just think there's a high level of disseminated erroneous information. I think I'm not going to get on a big soapbox, Tom, because it is your choice, right? But I also think that ever since President Obama ran for office and someone asked for his birth certificate, we have been inundated with disinformation from that point to this point. And I think it's dividing our country, and it shouldn't, because we're all here, our brother's keeper. And when I say brother, it's a general term. I mean my sisters too.
Indeed.
So, we're one race. It's called the human race.
Well, your point's well taken in terms of how social information can infect negatively and inspire positively, whether it's with Obama or just I mean, that's why the 1619 Project is so controversial. We're going through the stage of what is truth and what is fact. So your point's well taken.
Yeah,
I appreciate that. If your sons were on the show right now, what would they say?
Oh my God, they think I'm the Black Panther.
The Black Panther, the movie, or the Black Panther in terms of the movement?
The movie.
Oh, the movie.
Absolutely. They think I'm T'Challa.
And why do they say that?
They admire the work that I do, and the commitment I have. I think it's my responsibility, Tom. I'm not always successful. I'm a human being, but I think it's my responsibility to model what I want my kids to see and hopefully become. And again, I'm not always successful, but I challenge myself every day to be better.
Excellent. And I know Maritza challenged you each day to be better as well. And I'm going to challenge you each day to be better. And I say that not necessarily only jokingly, but for us to challenge each and every one of us in terms of our own personal accountability to do better. I think that's going to be the only way to kind of.
Yeah. Absolutely, Tom. That's the only way we're going to get out of it. I'm my brother's keeper, and every day I'm challenging myself to be a better version of a human being.
Excellent. Thanks. We have about 3 more minutes, and Harry will play the music. That's our clue that we can talk, but no one will be able to hear us because the music will be over our voice, and
Gotcha.
We're getting ready for the noon show. Any kind of closing thoughts or comments? I have one or two more questions, but nothing that's really burning. Anything that might be on your mind?
No, nothing really burning. I just would like for our New Haven residents and our residents of the state of Connecticut to be informed and make the conscious effort to protect your family and yourself.
Indeed. And it's your family, and even if you're an orphan and have no family, it's the family of this human family.
Correct.
Kind of getting lost in the shuffle. Stacey, thank you so much. Harry told me like we have 30 seconds. And again, the show about violence and how to create peace. Definitely, I hope that we can pursue that relatively soon. And again, I just want to thank you and reach out to Stacey and the crew and visit them down at what's your address again?
54 Meadow Street, New Haven, Connecticut. Oh, I'd be remiss if I didn't tell you that Director Bond told me to tell you hello.
All right, I said hello as well.
Absolutely.
And for people that are listening, friendship is important. Relationships are important. So for Maritza to say that, for me to kind of respond in a way, you got to build this community of friends. And even if you have enemies, don't kill them. I mean, that's a different story.
Absolutely. Thanks, Tom.
Thank you so much, Stacey.
Yeah.
My pleasure.
As I got another rhyme, another
Let me know.
rhythm for y'all to listen. I'm never quitting on my
Get
mission.
together.
I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going. Better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving. Cause
This is Harry Groves, and you're listening to WNHHLP 103.5 FM New Haven.
Cause this is my road. Lights, camera, action, I'm ready to go. I'm never gonna give up. Fall down, I just gotta get up, hey. Yeah, this is my road. Lights, camera, action,